You with Body Radiosurgery. We hit your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic, large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Our goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212-CHOICES, 212-CHOICES for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. Not only super convenient, super. Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212-CHOICES, 212-CHOICES.
With Dr. Lederman, the best prostate cancer treatment is custom tailored for you. Each man with prostate cancer is unique and seeks the best results based on PSA, Gleason score, and stage. That's why Dr. Lederman's custom-tailored prostate cancer treatment is most logical. Not every man should get the same treatment. Dr. Lederman's custom prostate cancer treatment is all outpatient. Our goals are your best results, avoiding radical surgery, maintaining your sexual and urinary function, and your life. Most insurances, Medicare, Medicaid accepted. Call Dr. Lederman at 212-CHOICES, 212-CHOICES for a fresh second opinion and free booklet DVD. Not only super convenient, super in Manhattan, 38th and Broadway. To hit the cancer, call Dr. Lederman, 212-CHOICES. Cherish your life. Custom prostate cancer treatment with Dr. Lederman, 212-CHOICES.
Welcome back to the Radiosurgery Hour. This is Rob Redstone here with Dr. Gil Lederman at the WOR Studios in the heart of New York City. We're just a few steps from the Radiosurgery New York Cancer Treatment Center on Broadway and 38th Street. Dr. Lederman, the leading cancer expert, treats prostate cancer non-invasively. He was the first in New York with fractionated brain radiosurgery, and he's the first in America and in the Western Hemisphere with body radiosurgery. You can also call Dr. Lederman at 212-CHOICES for a free informative booklet and DVD. Hey, Dr. Lederman, we're back.
Hey, we're back, and if you have questions, please call us. If you have medical questions during the weekend or anytime, please call us at 212-CHOICES, 212-CHOICES, or during the week for that booklet DVD. Please feel free to call that up. I wanted to speak about a woman who came to us this week, actually came Friday. She's 82 years old with 3 boys, and she had one daughter who died of COPD, sadly to say. And she had invasive lobular carcinoma of the breast and lobular carcinoma in situ. So she went elsewhere. She just had a biopsy, which was a good thing. And she had mammograms, so she came to us to ask what to do. And I told her the best thing to do is to get staged up. Now, she's scheduled for a lumpectomy the week of Labor Day, and I said, well, why don't you get staged up and you'll know exactly where the cancer is. And she said she doesn't want to do anything to delay her treatment. I said, well, I can get you a PET scan today. And sure enough, we got approval today for a PET scan. So we don't delay things. I mean, like that patient said who went elsewhere, he had a 48-day delay between his call and treatment. This woman called. We saw her. Well, she wanted to get staged. We got the approval from an insurance company immediately, so she knows where the cancer is and knows all the options. There's an article this week in MedPage that looked at mortality rising with changes in urologic care. It's an article that was just published. It was written by planner Charles Bankhead, who was the staff writer, and he writes that the incidence of preventable inpatient deaths associated with common urologic procedures has increased significantly over a 12-year period, coinciding with a shift of more procedures to the outpatient setting. The overall mortality was stable, but the deaths resulting from failure to rescue increased by about 18%. Now, what is failure to rescue? Well, older patients, sicker patients, minority patients, publicly insured patients, patients who receive care at city hospitals had an increased failure to rescue. That means less was done for those patients to try to solve a complication that they had in the hospital. So failure to rescue has become an emerging problem. And why is it that older people, sicker people, minorities, blacks, publicly insured people, and people who got care at city hospitals had less rescue? Well, they probably had less rescue because they didn't have their own doctor who was an advocate. A doctor has to be an advocate for the patient. Your doctor has to be on the same wavelength as you. You have to be able to communicate with the patient and feel comfortable with each other. The doctor has to fight for you. Is your doctor fighting for you? Is your doctor answering your phone calls? Is your doctor available 24/7? Is your doctor the person that you see? Is your doctor the person that's caring for you, hands-on, answering your questions, being available, taking care of your problems? Well, those are all signs of failure to rescue if the answers were no. So if you can't communicate, you may want to think about getting a different opinion, because you don't want to be in a pickle with a complication and be one of those mortalities because of failure to rescue. So make sure your doctor is willing to fight for you if you want that. Obviously, you're the president of the United States of your body. You get to choose what you want, but you should know at least that some doctors fight, and we don't want to be in a circumstance with you or anyone, in fact, of a failure to rescue. Sad story, failure to rescue. Earlier in the show, I talked about pulmonary disease is linked to increased cancer risk. Well, there's an article in the American Journal of Respiratory and Critical Care Medicine that, and I'm reading from the ASCO Post, links between a number of common respiratory diseases and an increased risk of developing lung cancer have been found in large pooled analysis of 7 studies involving more than 25,000 patients. It was written by Denholm and published in the American Journal of Respiratory and Critical Care Medicine. In this article by the ASCO Post, associations between various respiratory illnesses and lung cancer have been shown in earlier studies, but few of these studies considered multiple respiratory diseases simultaneously. There was a pooled study of 12,000 cases and 14,000 controls, and they found a relationship between lung cancer, bronchitis, emphysema, pneumonia, with a greater increased lung cancer risk among subjects with all 3 of these conditions. Well, probably the people that had all 3, bronchitis, emphysema, pneumonia, histories, were probably more likely to be smokers. And most people, not every person, but most people with lung cancer have smoked. So, what to do? Well, if you're a smoker, you may want to stop. That would be the smartest thing. If you've never smoked, great, congratulations, and you may want to never think about starting. My name is Dr. Lederman from Radiosurgery New York. We're at a cancer treatment center in Manhattan. We're very close to Penn Station, Grand Central, Port Authority, the bus station, PATH trains, most of the subways, buses, and trains in New York that come to Times Square and Herald Square. Our office is on Broadway, just between Macy's and Times Square, 38th Street and Broadway. So most everyone in New York knows where we're located. They may not know we're there, but they know that location, 38th and Broadway. It's a great place to be. Nowadays, there's all kinds of chairs and tables on the street, so it's actually a great place to sit and watch all the beautiful people in the fashion district. It's easy to get to, and best of all, it's a private cancer treatment center where we take care of the patient, you, for your needs, not for the drug company's needs, not for the surgeon's needs, for the possibility of having a fresh second opinion and having choices about your cancer treatment. So if you're not doing great, or you don't feel confident with your care, or the cancer's progressing, you may wish to give us a call at 212-CHOICES, 212 Choices to get a fresh second opinion. We also have the booklets and DVDs, which we're happy to send to you. We have something called the Urgent Cancer Consultants. People often ask, how long is the wait to see you? Well, if you need, we'll see you within one business day. We'd rather work more so you get the right answer and you don't suffer. We have a variety of treatments. We have our own linear accelerators. We have CAT scans. We have operating rooms. We do prostate brachytherapy right there. So, if you have questions during the week, please call me. My name is Dr. Lederman, 212 Choices. Thank you for listening. Have a great day, and God bless you. Bye now.
Thanks for tuning in to the Radiosurgery Hour with Dr. Gil Lederman and myself. If you have questions before next week's show or want a free informative booklet and DVD, just contact Dr. Lederman at 212 Choices. That's 212-246-4237. That's 212-246-4237. Till next week.
For cancer treatment, most prefer effective, non-invasive, well-tolerated outpatient therapy. That's Dr. Lederman, the radiosurgery pioneer's goal too. Dr. Lederman is first in America, first in New York, first for you with body radiosurgery. Dr. Lederman hits your cancer with no cutting, no bleeding. Dr. Lederman has decades of experience with primary and metastatic large or small cancers from head to toe. Cancer treatment with possibly a second chance for you, even if chemo, radiation, or surgery didn't work or isn't tolerated. Goals are best results and quality of life. Meet Dr. Lederman to hit the cancer. For a free booklet DVD, call 212 Choices, 212 Choices for a fresh second opinion. Most insurances, Medicare, Medicaid accepted. Not only super convenient, super. Broadway and 38th in Manhattan. To hit your cancer, see Dr. Lederman, 212 Choices, 212 Choices, 2 Choices, 2 Choices, 2 Choices, 2 Choices, 2 Choices, 2